There's a quiet fear that many seniors carry, but rarely speak about. It's the moment when a doctor looks at you and says, "You need surgery." Suddenly, everything feels uncertain. Your mind starts racing, your heart feels heavy, and you begin to wonder, is this really the only option? For many older adults, this moment doesn't just bring medical concern, it brings emotional weight. Questions like, will I recover? Or what if something goes wrong? Become impossible to ignore. And deep down, there's often a silent fear of losing independence, of not being able to return to the life you once knew. I've seen this hesitation in so many people. Seniors who felt rushed into decisions who later wondered if they had all the information or if they simply trusted too quickly. And the truth is, not every surgery that is recommended is always the best choice, especially as we age. Because here's something most people don't openly talk about. Some surgeries carry risks that can outweigh their benefits in older adults. Longer recovery times, complications, reduced mobility, these are real possibilities that deserve careful thought, not quick decisions. At the same time, there are certain surgeries that can truly change lives for the better. The right procedure at the right time can restore movement, reduce pain, and even extend quality years of life. The challenge is knowing the difference. That's exactly what we're going to explore today. You'll discover 3 surgeries that many seniors are advised to get, but may not always need or should approach with caution. And just as importantly, you'll learn about 3 surgeries that can genuinely improve your health and independence. As you listen, you may recognize your own situation, or think of someone close to you facing a similar decision. And that's important because the goal here is not fear, it's clarity, confidence, and making choices that truly protect your future. So stay with me, because one of the surgeries we're about to discuss is often recommended very quickly. Yet many people later wish they had paused, asked more questions, and explored other options first. Let's start by understanding something very important. In medicine, recommended does not always mean necessary, especially in older adults, where the body responds differently, heals more slowly, and carries a higher risk of complications. This is why a deeper look at certain common surgeries becomes so important. One of the most frequently recommended procedures for seniors is spinal surgery for back pain. Now, back pain can be incredibly limiting, affecting everything from walking to sleeping. But here's the surprising truth. Many cases of chronic back pain are not actually fixed by surgery. In fact, studies have shown that for conditions like degenerative disc disease or mild spinal stenosis, surgery often provides no better long-term relief than physical therapy, gentle exercise, and lifestyle changes. I remember a patient in his early 70s who underwent spinal surgery hoping to finally fix his pain. Months later, he was still uncomfortable, but now also dealing with stiffness and reduced mobility. What he needed wasn't a more invasive solution, it was a more patient, consistent, and conservative approach from the beginning. Another surgery that deserves careful thought is knee replacement, especially when recommended too early. Knee pain is very common with age, and while knee replacement can be life-changing in severe cases, many seniors are advised to go for it before trying all other options. The reality is, early-stage arthritis can often be managed effectively with weight control, strengthening exercises, physical therapy, and even simple daily movement adjustments. The issue isn't the surgery itself, it's the timing. When done too soon, before the joint is severely damaged, the risks may outweigh the benefits. Recovery can be long, sometimes painful, and not every patient regains full mobility as expected. Now here's another one that often surprises people. Certain heart procedures, like stents, are sometimes overused in stable patients. If someone is not having a heart attack but has blocked arteries, placing a stent might seem like the obvious solution. But research has shown that in many stable cases, medication, diet, and lifestyle changes can be just as effective in preventing major events. This doesn't mean stents are bad, they can be life-saving in emergencies. But in non-urgent situations, rushing into a procedure without exploring medical management first may not always be the best path, and this brings us to an important realization. More intervention does not always mean better outcomes. In fact, sometimes the safest and most effective approach is the least invasive one. But now let's shift our focus because not all surgeries should be delayed or avoided. In fact, there are certain procedures that, when done at the right time, can dramatically improve quality of life, restore independence, and even prevent serious complications. In the next part, we'll talk about those life-changing surgeries. The ones that many seniors actually wait too long to get and why timing makes all the difference. Now that we've covered the surgeries you need to approach with caution, let's focus on the ones that can truly improve your life if timed and executed wisely. The first is cataract surgery. Many seniors delay it, thinking it's minor or unnecessary. But the truth is, clear vision is essential for safety, mobility, and independence. Simple removal of cataracts can restore eyesight almost instantly, reduce the risk of falls, and even improve mental health by allowing you to engage fully with life again. Another procedure that can be life-changing is hip replacement. When a hip joint is severely worn or damaged, living with constant pain isn't just uncomfortable, it limits mobility, leads to muscle loss, and can affect overall health. A properly timed hip replacement can relieve pain, restore walking ability, and give you back years of activity you might have thought were gone forever. The key here is early consultation, proper pre-surgery conditioning, and following post-operative care diligently. Heart valve surgery is another example where timing is critical. Conditions like aortic stenosis or mitral valve problems can slowly weaken the heart. Waiting too long can cause heart failure, while timely intervention can extend life and dramatically improve energy levels and stamina. It's amazing to see patients who were once breathless during simple walks regain the ability to enjoy daily activities without fear. But beyond these surgeries, what matters most is supporting your body every single day so that recovery is smoother and complications are minimized. Simple daily habits, like walking gently for 20 minutes, practicing balance exercises, staying hydrated, and eating anti-inflammatory foods can make a huge difference in how your body responds to surgery and heals afterward. Many seniors make the mistake of thinking surgery alone will fix everything. Recovery is not passive, it's active. Strengthening muscles before surgery, maintaining a healthy weight, managing chronic conditions like diabetes or high blood pressure, and staying mentally engaged all dramatically improve outcomes. Even small changes like adding a protein-rich breakfast or doing chair exercises can impact your resilience and long-term health. And don't underestimate the role of mindset. Patience, consistency, and realistic expectations are just as important as the procedure itself. Your body heals better when stress is managed, sleep is prioritized, and you feel supported by family, friends, or a trusted care team. By combining these lifestyle habits with careful, informed decisions about surgery, you give yourself the greatest chance not only to recover but to thrive. You create a foundation that protects your independence and allows you to enjoy the activities you love, without fear of preventable complications. As we come to the final part, I want you to take a deep breath and really let this sink in. Your health decisions are among the most powerful choices you will ever make. Every surgery, every daily habit, every small step you take matters because they shape not just your years, but the quality of those years. Think about it for a moment. Imagine waking up each day feeling lighter, more capable, more confident in your body. No longer limited by pain, poor vision, or fear of falling. That's not a dream, it's a reality many seniors achieve by making informed choices and embracing the right interventions at the right time. The message I want to leave with you today is simple but vital. Not every surgery is life-saving, but some truly are. Not every intervention will help you, but some can restore your independence and energy. Your body deserves both caution and care. Your life deserves clarity and confidence. Remember the 3 surgeries to approach carefully: spinal surgery, early knee replacements, and certain non-urgent heart procedures. And equally, remember the 3 that can be transformative: cataract removal, hip replacement, and properly timed heart valve surgeries. Combine this awareness with daily habits that strengthen your body, nourish your mind, and support your recovery, and you're creating a life that's safer, stronger, and more fulfilling. It's never too late to take control, to ask questions, and to make choices that serve your long-term well-being. Reach out to trusted doctors, seek second opinions, and listen to your body. This is your health, your independence, your life, and you have every right to protect it wisely. If there's one thing I hope you take away from this video, it's this: informed decisions, small consistent actions, and timely interventions can change everything. You can thrive, regain confidence, and enjoy the freedom that comes with a body that supports your life rather than limits it. If you found this guidance helpful, I encourage you to like this video, subscribe for more senior health insights, and share your thoughts or questions in the comments below. Your journey matters, and by staying informed, you're taking the first step toward a stronger, healthier, more empowered tomorrow.